welcome you all in this session of Shirodhara in clinical practice, diverse therapeutic applications. I am Dr. Rajkala Patil, a head and associate department of Panchakarma. In today's lecture, we will discuss we will explore the Shirodhara, understanding its types, procedure detail, indications and applications. So coming to the what is Shirodhara? It is a type of Bahyasneha in which suitable liquid is poured on the forehead and then allowing to flow over the scalp from a specific height in a specific manner. It can also be described as a process of irrigating the head with various liquids tailored to the patient's condition, specific disease and seasonal consideration. The synonyms of Shirodhara includes Shiroparisheka, Shiraseka, Shirasechana and Prasechana. The term Shirodhara itself derived from the Sanskrit word Shiro, that is head, and Dhara, that is to flow. The therapy entails the rhythmic and steady flow of lukewarm substances such as oil, milk or buttermilk onto the forehead. According to the condition, we change the liquid. So, when it does with the oil, it known as a Shirodhara with Taila. When we use decoction or Kashaya, we name as a Shirodhara with Kashaya. When we do it with buttermilk, it known as a Takradhara, which is explained in the Dhara Kalpa of Sahasra Yoga, or a book from the South India known as a Dhara Kalpa. Classical indications of Shirodhara is Arunshika Shira Toda Daha Paka Vraneshuto Parishekaha. It is a kind of Parisheka, that is Shirasheka, it's called as a Shirodhara. The classical indications told by the Acharyas are Arunshika, that is seborrheic dermatitis, Shirastoda, that is pricking pain in the head, Daha, that is burning sensation in the head, Paka, that is suppression in the head or inflammation leading to the formation of pus, that in the level of scalp or head, Apasmara, that is epilepsy, Shankharoga, kind of headache, or Satat Jwara, that is the where the in text Stri Dugdha is described for the Santata Jwara Parisheka. Coming to the clinical indication, these are all previous slide which we discussed is all the textual references where clinically we found the Shirodhara is most effective treatment and which is not explained in the text. These indications are IBS, that is irritable bowel syndrome. As it is a psychosomatic disease, the somatic part of the disease is can be cured with the medicines, but for the psycho part of the disease we need the external therapies. So, Takradhara and Shirodhara is the most effective in the irritable bowel syndrome or in the ulcerative colitis or in the Crohn's disease, where there is a more bleeding is there and patient is having anxiety. This treatment does the miracle. Coming to the neurological disorders like headache, epilepsy, facial palsy, convulsive disorders, hypertension, stress, in all these conditions, Shirodhara already has been proven as an effective therapy. And coming to the psychological disorders like psychosis, neurosis, insomnia, anxiety, in such conditions also Shirodhara is a choice of procedure to heal the patient. And coming to the skin disease, as in skin diseases, many panchakarmas are contraindicated or local therapies are contraindicated, but in psoriasis and eczema, whenever there is nirama avastha comes or after shodhana, when patient ask for the soothing therapies, so Shirodhara or Takradhara is the choice of treatment. Coming to the other clinical indications of Shirodhara, that is anxiety disorders, mental exhaustion, irritability, hypertension, insomnia, phobia, depression, ADHD, attention deficit hyperactivity disorder, other neurobehavioral disorders is the indicated or indication for the Shirodhara. Coming to the contraindications of Shirodhara, as Panchakarma is concerned, there are the conditions where we can do the Panchakarma and some conditions are contraindicated. So, in Amavastha of any disease which is indicated for Shirodhara is contraindicated for Shirodhara, because in Amavastha already there is Ama or there is Kapha predominance, and if we do the Shirodhara that will aggravate the disease, that is why it is contraindicated. Diseases like recurrent rhinitis, allergic rhinitis, in such condition, if there is a Amavastha or active phase is there, Shirodhara is contraindicated. Of course, in the Niramavastha, the Shirodhara can be done with the Kashaya. Like fever, pyrexia, if there is a Amavastha, it is contraindicated for Shirodhara. Inflamed skin of the forehead, we cannot go for the Tailadhara, but of course, sometime Kashaya Dhara or Kashaya prepared with specific uh, decoction or specific herbs which heal the inflamed skin, that can be done, but ideally for Tailadhara it is contraindicated. In addiction of narcotic drugs is the contraindication for Shirodhara. Alcohol intoxication, if patient is in intoxication, this procedure cannot be done. So when patient come out of that, that time it can be practiced. Or Kaphaja Vikara, where there is Shirodhara, may increase the further kapha or it may be make the disease difficult to cure. So coming to the various types of Shirodhara, as we first discussed in the first slide only, Shirodhara can be called as a Tailadhara, Takradhara, Kashaya Dhara when we use decoction, Dugdhara when we use milk, Jaladhara when we use warm water, or Dhanyamla Dhara when we use Dhanyamla for the Shirodhara. Mostly Dhanyamla is used in the skin conditions or psoriatic condition for the Shirodhara, and Jaladhara when patient cannot offer or cannot bear the drug cost there and we need the procedural effect of Shirodhara, we do with the Jaladhara. Dugdhara, if it is the severe Pitta condition is there, and in text also it is explained like whenever there is the Pitta predominance is though more, or whenever there is Santata Jwara, there Dugdhara is indicated, and if it is easily available, Dugdhara can be practiced. Kashaya Dhara, whenever there is Amavastha and we cannot go for the Tailadhara and we need the procedural effect or there is more anxiety in the patient, so Kashaya Dhara can be done with the Medhya Kashaya, Triphala Kashaya, Manjishtadi Kashaya according to the condition of the disease and condition of the patient. Takradhara can be practiced in many IBS or Crohn's disease or in diabetic neuropathy or in the diabetic retinopathy also. So Takradhara can be used for that, and other liquids which can be used for Shirodhara is coconut water or food vinegar. Instead of Dhanyamla we use food vinegar also, and we were getting the almost similar result with the food vinegar also. Material required for the Shirodhara is Shirodhara device, that is Shirodhara Patra, one Varti, suitable liquid may be Kashaya or Takra or Taila, that is 1.5 liter, gauze piece 1, cotton earplugs 2, soft pillow covered with Rexine, that is 1, and hot water bath 1 for to warm the liquid. Vessels 3, oil for talam, that is 10 ml, Rasnadi Churna 5 gram, soft towels 2, Dhara Patra and attendants. With this, coming to the pre-operative of the procedure, Abhyanga should be done over the face, neck, shoulder and chest. Whole body Abhyanga can also be done if we need further procedure or we need the effect of Sarvanga Abhyanga also, that can be done. But for the pre-operative of Shirodhara, local Abhyanga is mandatory, but in Tailadhara it is mandatory. In Takradhara or Kashaya Dhara where we are doing in the Amavastha or in where we need the Kaphahara treatment, so there it is not mandatory to do the Abhyanga. Gauze is tied around the head above the eyebrows of the patient. After closing the eyes, cotton should be kept over the eyelid and it should be tied with proper bandage. Earplug should be applied. Coming to the selection of medicine, it is written in the Dharakalpa, if it is a Vataj disease is there, Balatela, Dashmoli decoction can be used. In Pitta Charoga, Chandana Tela, Ushira decoction, coconut water or milk or Grita can be used. In Kaphaja diseases, Nagar Musta or Madhuyashti decoction can be used. Coming to the procedure, as we see the detailed procedure in the video also, here is the glimpse of the procedure. Patient should lie in supine position on the droni with a pillow under the neck, and the Shirodhara device should be placed near his head. This should be done before to fix the Shirodhara Patra, because after once the patient lie down, it is very difficult to move it. So that's why first only before patient lying down, Shirodhara device should be fixed. Eyes should be covered to protect from oil with cotton and gauze to avoid the oil or the liquid poured in the eyes, or spillage of liquid in the oil in eyes. In height, its height should be fixed such that oil should fall from a height of 4 angulas in a continuous stream. Serrated coconut shell, which is showed in the picture, should be placed inside the apparatus to maintain uniform dhara. Oil should be heated just above body temperature, that is 38 to 40 degrees Celsius, and poured into the dhara patra. Selection of sneha according to the dhara kalpa. In Vataj dosha, it is written that Tila Taila should be chosen. In Pitta dosha, Ghrita should be chosen. In Kafaj dosha, Tila Taila should be used. In Rakta dosha, Ghrita can be used when there is the combination of Vata, Pitta, Rakta. Ghrita plus Taila in equal parts should be used for dhara, and whenever there is vitiation of Vata, Kapha and Rakta, half part of Ghrita and one part of Tila Taila should be used. The reference of this detail is given in the Dhara Kalpa. Coming to the techniques of Shirodhara, various oscillatory procedures can be adopted as per the condition of the disease and patient. As in the video, we can see the linear movement of the Shirodhara, or linear oscillation or circular oscillation procedure, or the oscillation in the shape of 8. This is what different techniques we use in the Shirodhara. Points to be remembered: a continuous stream of oil should be allowed to fall on the entire forehead while oscillating the dhara patra. Uniform oscillation is required for uniform dhara. Simultaneous massage with other hand should be done. The oil should be recollected from the hollow of the droni, reheated and poured back into the dhara patra. The post-operative procedure is gauze and earplug should be removed and head must be wiped off with the towel. Rasnadi churna should be applied over the head, which is known as the talam, post-operative talam, which we usually practice in the South India as a post-operative of Shirodhara or Takradhara. Hot water bath can be done if prescribed after 1 hour. Head bath should be done with the lukewarm water if it is Takra or Dugdhara. In Tailadhara, it is not advisable to do the head bath every day. After 3 days, the patient can do the head bath, or after 7 days. It is better to avoid the head bath for the 7 days. Coming to the duration of Shirodhara, it is 45 to 60 minutes for the required number of days. It may be done between the 4 to 6 p.m. or 7 to 11 a.m. It is believed that by this therapy, the effect can be achieved up to the limbs and entire body by 21 days. According to the Dhara Kalpa, patient having dryness and Pitta Yukta Vata, the period of Shirodhara should be 2/3 or 2.5 Muhurta to 2 Muhurta. In Snigdha Kashaya Yukta Vata, it should be 1 Muhurta. That is, the Muhurta in Dhara Kalpa is 987 Matra is the 1 Muhurta. Period of changing the liquids: milk should be changed every day, Dhanyamla should be changed after every 3 days, and oil should be changed after 3 days. On 7th day, both oil first and second half should be mixed and used for the dhara. This is the same method we use for the Pijichil also. Precautions: vigilance is essential to prevent oil from the inadequately reaching the eyes. Patients are advised to remain awake and alert throughout the procedure. It is crucial to maintain a moderate height, viscosity and control flow rate of the liquid. Minimize hair interference by shaving the patient's head as much as necessary. It is very difficult in females to remove or shave the hairs, but in male, if it is possible, we should shave the hair. Diligent attention is required to ensure a continuous flow of medicated liquid and to regulate the temperature of the Shirodhara mixture. The parihara, or the things which should be avoided during the procedure, is the patient should be advised to steer clear of the following: physical strain and strenuous activities should be avoided, emotional turmoil including excitement, anger, sorrow and strong desire should be avoided, exposure to the cold weather, direct sunlight, dew, strong winds, smoke and dust should be avoided, activities involving riding elephants or horses should be avoided, prolonged periods of continuous walking, standing or sitting should be avoided, Excessive or lengthy speaking, especially at high volume, should be avoided. Daytime napping or sleeping should be avoided. Using a pillow with either excessive height or low elevation should be avoided. This is the Parihara Kala during the all procedures. It is also suitable for the, or it is also applicable in Shirodhara also. Parihara Kala, how many days patient has to follow the do's and don'ts is the patient is advised to adhere to the Patha diet and maintain a state of Jitendriya, that is control over the senses throughout during the therapy. With this, I thank you all for listening the Shirodhara in detail. एक्चुअली इसके बाद मैंने ना कुछ स्पेशल रेफरेंसेस है, क्योंकि ये मुझे ये था कि ये टाइम ड्यूरेशन कितना होगा, तो ये आगे का जो है ना वो जिसको डिटेल चाहिए उसी के लिए है, बट डीपर ये है, ये तो जनरल हो गया। उसके बाद हमने मतलब जैसे वो धारा कल्प का हमने रेफरेंस दिया है साउथ इंडियन बुक का, तो उसका डिटेल दिया है कि स्पेशल रेफरेंसेस फ्रॉम धारा कल्पा फॉर द शिरोधारा। तो आप इसको कर कितना मिनट्स हुआ, तो हम उस मिनट्स छोड़ दिया, कर दिया। अच्छा, तो फिर मैं परिहार काल को फिर से रिपीट करके उसको कंटिन्यू कर देंगे, है ना। इसके बाद थैंक यू ना। हाँ, so coming to the Parihara Kala, the patient is advised to adhere to Patha diet and maintain a state of Jitendriya, that is control over the senses throughout the duration of therapies. And there are some special references from the Dhara Kalpa. Here we discuss references from Dhara Kalpa which are useful in not only Shirodhara. These are the useful things for the Pijichil, Shirodhara, Takradhara, and these are the practices from the Kerala or South India. The specification of Dhara table which is shown in the picture, this is the specifically designed for Dhara. We call it as a Dhara table or Dhara Pati. Woods which we use or woods of medicinal plant which we use for the Dhara table are Plaksha, that is ficus lacquer, Udumbara, Chandana, Varuna, Devadaru, Ashoka, Amra, Nimba, Bilva, Arjuna, Khadira or Agnimanta. These woods only we use for to prepare the Dhara table or Dhara Pati. The dimension are that which can accommodate the body of an average individual. This is the dimension of Dhara table. The specification, the foot end of the table, as you can see in the picture, the foot end of the table consists of an orifice or a tapered opening through which the liquid is poured over the patient's body and the flow down into a collection vessel. This collected liquid can be reheated and reused for the dhara until the completion of the treatment duration. The head end of dhara table, at the head end there is an elevation or hard rest which forms a bridge between the elongated portion of the table meant to accommodate the rest of the body from a small chamber portion of the table which is extended behind the head end. And head part, the medicines poured on the head as a part of Shirodhara collects in this chamber and flows back into an orifice or tapered opening at its center a few inches away from the crown of the head and gets collected in another collection pot. These too can be recycled and reused just like a liquid of Sarvangadhara is done. Specification of Dhara Patra and Varti. Dhara Patra should be 5 to 6 inches depth with wide open mouth, round at the bottom with a capacity of approximately 2 liters. There should be a hole of size or little finger at its center of the bottom. There should be 3 holes with equal distance to the ridges of the patra to tie up 3 strings for the purpose of hanging over the stand. Dharavarti, as you can see in the picture, Dharavarti is a wick or a string of loose cotton thread with a free end of about 4 inches coming out through the hole of a dhara vessel. The thread of wick should be packed only just firmly as not to slip of the hole, but loose enough to permit a continuous and regular dripping of liquid that is poured into the dhara vessel. And in Dhara Kalpa, the Dhara dosha are mentioned as When it is done from the very height, fast, slow, then it may produce the murcha, shula, chardi, raktapitta or jwara. That is, patient may get unconsciousness, may get the pain or headache, may get vomiting sensation, or he may get the feeling of more or bleeding through nose or ear, or he may get the fever. The management of Dhara dosha are, the Gandusha is advisable, that is a therapeutic practice involving mouth rinsing, Nasya, a nasal administration technique can be used, Shunthi Kashaya Pana, consumption of a ginger based herbal decoction or Kashaya can be done, a light evening meal accompanied by a pepper infused broth can be given. On the third day, a basti, that is enema, can combined with sendava or rock salt can be given. In contemporary times, fully automated Shirodhara devices are accessible, allowing for precise customization of parameters such as temperature, quantity, drip rate, duration and oscillation according to the patient's need that can be also used. With this, thank you.